So for this study, this was another project that was through the Pediatric Real World CAR Consortium. And so this was presented by Krista Krupski in the late-breaking abstract, and we conducted a study where we evaluated patients that had received a second infusion with Tisagenlecleucel. And we found that patients, and I just want to give you a few numbers here. So we had 43 patients who received a Tisagenlecleucel infusion. The median age of patients that were getting infused was 12. And we found a median time to second infusion was 173 days. The indications for reinfusions were non-responsive CAR T-cell patient only in one patient, and for B-cell aplasia loss while in an ongoing remission, 26 patients, and then for disease reoccurrence, which was in 15 patients. And then of 43 patients, we had 35 that received standard lymphodepleting chemotherapy prior to the reinfusion. And there were 8 patients that actually received increased lymphodepleting chemotherapy doses. Overall, the Tisagenlecleucel reinfusions were well tolerated, and the rates of 3+ CRS were 23 and 23%. And the rate of grade 3 neurotoxicity was only 2%. And then among 16 patients that had been treated with CAR reinfusion due to disease non-response, 8 received a morphologic complete remission after the reinfusion. 3 of those patients developed a fulminant relapse after reinfusion, and 5 achieved an MRD negative status as opposed to just a morphologic complete remission. And then of those, 4 relapsed at a median time of 138 days. And then for 26 patients that were reinfused after BCA loss, 5 had detectable disease at day 28. And then there were 7 that maintained their complete remission status and successfully re-achieved B-cell aplasia at day 28. And they had B-cell aplasia last for about 66 days. And so reinfusion achieved B-cell aplasia in about 33% of patients who had lost B-cell aplasia. Tisagenlecleucel reinfusion was successfully used to bridge 27 of the 43 patients to a stem cell transplant. And of the 18 evaluable patients, the median time to CAR reinfusion to stem cell transplant was 123 days. So in summary, we report CAR T-cell infusions are well tolerated and can successfully achieve a complete remission or reestablish B-cell aplasia in some patients, yet these remissions and ongoing B-cell aplasia is usually brief. And so consideration can be given to using it as a bridging therapy to transplant, but it's seemingly not as a definitive therapy in most patients.